Hello, everyone. Welcome to our Pride celebration, where we're going to have this beautiful panel of people and possibly more people popping in, where we're just going to talk about all things LGBTQIA+ in general. Questions that you guys have had on Instagram, such as, should I come out at work? How should we discuss things like this with patients? How are we asking about orientation, sexuality, all of that in a way that doesn't make you just feel like, wow, I'm uncomfortable, and everything else that comes up in discussion. Fair game. We're just here to have a chat about this, see where this goes. If you are newish here, I'm Liz. I am a family nurse practitioner. I use she, her pronouns, and we're going to probably learn about how I am very not of the space here where I'm very good at the words, but I think cis straight.
Yeah.
Cis straight. There we go. And I'm going to hand it off. We're going to go around the panel. Everyone's just going to introduce themselves. In a perfect world, we would have name cards on here, but I can't figure that out. So if you have ever used StreamYard and you know how to do this, please do tell. Everyone here is pretty much in the healthcare sphere, so that is where this conversation is going to be directed. But any of you are more than welcome to share your own experiences, any questions that you have, and any money that we do make on this stream, we're then going to do a poll at some point, and everything is going to get donated to a charity of our choice that we feel is appropriate and helpful at this time. It's probably going to go into, well, we'll figure it out later. I was going to say it might be going towards like transgender patients' mental health, something, just because I feel like that's super under attack right now. But I said we'll vote, so I won't steamroll the vote. All right, Zan, would you like to go next? You're below me on my screen.
Sure. My name is Zan Lutsky. I use they, them pronouns. As far as how I identify, I would say I'm bi and or queer. I'm also non-binary trans, and I'm an RN. I was one of the lucky nursing students who got to do COVID nursing school. I graduated this past August, and I moved up here to Baltimore from Myrtle Beach, South Carolina.
That sounds exciting. Myrtle Beach is one of my dad's favorite places.
I'm so sorry.
I have the same feeling.
He loved it. He was like, yes. We loved it. We accidentally went during Biker Week. The only time I've ever been there. It was a unique experience.
Which one?
I was very pregnant. The
Memorial Day.
It was, I think, Memorial Day. It was very interesting. It was a culture shock. Scott, would you like to go next?
Sure. I'm Scott. I have the Nurse Scott YouTube channel, and I've been a registered nurse since 1992 in emergency departments. I am a cis male, gay. I'm cis male, gay. I don't know what order they go in. I use he, him pronouns. That's confusing. I was born male. I live as male. I'm attracted to other males. And so gay, sodomite, homosexual, I know what I am. It doesn't really matter. I'm originally from St. Louis. Missouri. I've lived in LA, and I currently live in San Francisco. I've done travel nursing assignments around some other places too. So
that's very cool.
That's me.
And Cal.
So I'm Caleb. I'm a bi, cis male. I go by whatever you call me. I don't care.
That's dangerous. Don't say that.
I mean, sometimes it backfires, but for the most part, I'm pretty good. I'm an RN. I work primarily in geriatrics, short-term rehab, long-term care, and I've been doing that since 2015, 2014, somewhere around there.
That's exciting. I'm momentarily distracted because our names just showed up, so I'm going to try to change mine. I was like, what? Yes, but now I can't figure it out, so it's fine. All right, I'll
I think if you look on the bottom left, it should have just your video and the three dots.
If
you click on that, you should be able to change your name.
Perfect. Okay, so let's add that. Perfect there. Okay, perfect. So, yes, OB Nurse Chelsea, we got the name tags up. I don't know who did that. They're gone now again, but it was momentary and it was great. We are going to link everyone who is here that would like their social media to be on here down below so you can go find them. I think Scott is the only one putting himself out there on the internet at the moment. So he also has a video that is of interest that we will link in here. You can put it in the chat. So make sure to go check them out since they're coming here and, you know, helping me out by coming to my channel and joining our discussion. So hopefully I'm trying to start NurseTube, in case you can't tell, where we just all hop onto each other's channels and give insights and all the things. So we're going to make it happen eventually. One day the internet is going to cave and we're going to do it. Okay. So the very first question, I guess we can open it with a question because this is the most common one that I get all the time from people that watch my channel is, did you come out at work? If so, how was that? Did you feel safe? This is obviously going to vary based on where you live. But was it something that was known at work, or did you keep it hush hush? Let's just not really talk about it.
I mean, I guess I'll start. So I live and work in South Carolina, which is not exactly known as the most forward
not so
progressive state. Usually, and I work through agency, so a lot of times it will take me a little while to feel out the building, see what they're like before I'll be upfront. But you know, dependent on any sort of situation, you know, like I try and be very conscientious about treating people appropriately, whether it is CNAs being treated by patients appropriately, which unfortunately happens more than you think. And, you know, me personally, I don't care. I mean, I'm not the youngest chick in the woods anymore. So, you know, like, you can love me, you can hate me, whatever. I'm going to do my job, and that's how it's going to be.
Very fair. And like you said, I think where you live has a lot to do with necessarily how it's going to work and everything like that. But awesome. Zan, what about you?
Well, so like I said, I just moved up here. So my experience in South Carolina, I'm very open about who I am. I'm not bringing it up for no reason, but especially going by different pronouns. If I want to feel respected and have those pronouns used, then I have to bring it up because people just aren't educated or aware all the time. So in South Carolina, there was definitely a lot of harassment about everything. There's a lot of racism, homophobia, transphobia, all of that going on. And so my biggest focus there was being out, being open, and being there for any patients who might identify that way or have that concern. At that time, I was working in critical care. So we would see a lot of overdoses and things like that. And so that was increased within the LGBT population down there. So I was kind of always assigned to those patients. And I was happy to do that. But it wasn't easy. I would have patients refuse to let me take care of them because my hair was too short. It was one of the main reasons that I was told. And of course, I want my patients to feel comfortable, but at the same time, like I was a straight A nursing student. I was working as a nursing assistant at the time, and I was like, I know what I'm doing. Like, and also I'm mostly just wiping your butt. So it's hard to like feel like I was losing opportunities to learn and to be there for patients, especially when we were so understaffed, to have patients say that they didn't want my care, but we didn't have someone else to take care of them. It was a really hard battle.
Oh yeah. And that's got to be hard, like emotionally, when you're like, you would rather literally no one like than me. Just okay, like. Oh.
Well, and then trying to weigh it and like, do they have capacity to make that decision?
And,
especially like if they're on a ventilator or just things like that. It was really difficult. And so, of course we did whatever we could to make them comfortable and accommodate. but it's hard when it's almost every patient.
Yeah. Yeah.
And if I haven't had that issue since moving up here.
Mhm.
I used to get hate crimed at least once every 2 months living in South Carolina, and I haven't been hate crimed since I moved up in September up
Oh,
here. So
I
that's
hope it
been
stays
a
that way.
really nice
Yeah.
break.
Yeah.
I've never had a patient up here refuse care from me.
Mhm.
I've had patients who wanted to have conversations that
Mhm.
weren't necessarily the time or place. If I'm at work, I'm here to take care of you and your health, and that includes
Yeah.
your mental health. And I want you to be comfortable, but I'm not going to sit here and argue politics with you.
Mhm.
But I will gladly give you your medication and
Yeah.
listen to the logs. Like,
Yeah.
I think
Do you
more
have
of
an
my
example? Oh, sorry.
sorry.
Go for it. I was going to say, do you have an example of how you set a boundary like that? Like if anyone is out there and they're feeling like, I'm sure you are unfortunately not the first person who has had someone say something like super rude. Would you mind giving your example? And then I can kind of say an example of what I usually say when I overhear it. Cause I saw a lot of this with some different people that came through our clinic, and like, I can say something on the side, but I would love to hear if you would be willing to share, like, how do you put a stop to it when someone just says something where you're like, wow, that is just homophobic, rude, and uncalled for?
I think I'm really lucky. The hospital I work at really prides itself on diversity and inclusion, and
Oh, good.
so I'll just say something along the lines of like, no, we don't talk that way here.
Okay. Yeah.
Like
That's
if that's
Mhm.
your opinion, that's fine. You're still going to get the best possible care, but we're not going to discuss that.
Yeah. Good. Okay.
I'm honestly, I'm really blunt because that's the only way
Yeah.
to handle it. If you just try
That
to be like,
is,
oh, no, they're just going to keep going because they're going to see that as weakness and they're just going to keep targeting
yeah.
you.
Yeah. That's perfect. Cause that's exactly how I would handle it as a person. Like whenever I overheard it was exactly that, calling it out, whether it's homophobia or racism, and being like, that's really racist, or like, that's really homophobic and just rude. Like this is not what we're having a conversation about right now. And then off we go. And usually, I mean, a lot of people just didn't care, but then other people like stood there awkwardly. And who said, Kate, I just want to read this comment. I started my nursing career working in HIV care, and I remember nurses would not float to that floor.
Yeah.
Which is just wild and so sad. Okay, I interrupted you. Continue.
No,
you were
you're
saying
before we started, I had mentioned to y'all that I moved up here to work on a unit that specifically was designated as the unit for trans patients after having bottom surgery, which would be like genitalia surgeries, and then also for like chest flaps if you're going to be like inserting. Wow, I'm having a brain fart.
Any like silicone?
Anything. Yeah. And so, but like that wasn't the majority of our patient population.
Yeah.
But it was just, this was the surgical unit that you would go to if you were having those surgeries. Yeah. When I moved up here, our surgeon had left. And one of the main reasons I wanted to work on this unit was so that I could be a trans nurse taking care of trans patients and making them more comfortable.
Yeah, how lucky would they be? Because I'm sure they're just like, oh my gosh, I'm going into this, and I feel like, oh, that would have just been such a cool thing to be able to do.
Yeah.
Did you get a new surgeon?
No, not yet. We haven't. But I will say, I was also expecting the staff on that unit, like the other nurses, to have more training than it came across that they did. I know that it can be tricky with they pronouns sometimes, but like they just didn't seem to put any effort into caring. I had a coworker have a conversation with me in the break room, I think before she realized I was trans, even though like I had it on my badge that like my pronouns and everything. And she was like, I just don't understand like why these people would do this to themselves. And I was like, but so we had a good conversation, and I was like, well, I'm one of those people, and like it puts me in a place where I can really educate people, but at the same time I was a brand new nurse and I was like trying to get through orientation and I was like, I don't have time right now to have all these conversations with you, but I will when I'm off orientation. We're gonna have these conversations because I need you to treat your patients better.
Yeah.
And it's not
and it's important
mistreating them necessarily. Like they weren't like like being horrific and homophobic or anything, but just like those small little things that are really actually big things, like gendering your patient properly, making sure you're using their chosen name. It's not that much.
No, but some people certainly think it is. Cal, do you have any ways, or Scott, of how you shut down, like we were talking about, if people like come by and just have a, say something super homophobic or just really rude, how you shut them down? And Zan and I are on team blunt and fast and no.
I think to some extent you have to know the patient. Generally, being blunt and forthcoming is one of the better ways. But to give an example, to set the scenario, in geriatrics, most of the rooms that I work in have 2 patients or more. Generally, it's 2, but sometimes it's more. And I had a old lady, old white lady, and an old black lady in this room. And I don't remember what one of them was watching, but the white lady had said, I just don't understand why they have, why there has to be so many female leads on shows anymore. Like, I don't get this. And one of the ways that I was able to approach it is, I was like, look at it from a different perspective for a second. Let's step back. Everybody wants to see themselves as the hero of their story. Everybody wants to.
Oh, did he freeze or did I freeze?
No,
he froze.
It's a good pose though.
It is.
The way he's sitting there. All right. Hopefully we'll give him a minute. Hopefully he can come back. But I think that's a very good. Yikes. I think, like he said, everyone's seeing it just from their perspective, and obviously that they think they're right, and it can be hard. Cal, you froze.
Sorry. It must have been my connection.
Yeah.
What I was saying though is that, like, everybody wants to have a hero that looks like them and somebody that they can role model behaviors that they want to act like in the future. And so sometimes reminding people that, even though this might not be your cup of tea, maybe this isn't meant for you, and that it's important for everyone to be seen. It doesn't matter if you're gay, straight, bi, male, female, whatever. It's important for everybody to feel like they have a voice at the table.
For sure. That would be lovely, wouldn't it?
Well, to just not be scared to receive care. The amount of times that before I was in nursing school and like knew something about the care I should be receiving, I didn't go to the doctor when I should have. I didn't go to the emergency room when I should have, because I was scared how they were going to treat me. I was in nursing school and working in critical care as a nursing assistant when the things came out that, like, basically they had given permission for like health practitioners to refuse care to LGBT people. And living in South Carolina at the time, I was like, so I'm just going to die because I guess people will just refuse to give me care and there will be no one around who will be willing to. And like, I was
and
like,
that's horrific.
It was a really rough moment to have that conversation with my manager, because she was like, what's going on? Something happened at work. And I was like, no, something happened everywhere.
Yeah. And do you know where those states are? That was something else that people asked on Instagram was, can you as a healthcare provider refuse to provide care for someone who, like, you think is LGBTQ, anything like that? And I thought it was like, no, you really can't. Some people will like refuse to treat you like a normal, decent human. And in that case, you probably want to find someone else anyway. But I don't think you can like flat out refuse. But it sounds like maybe you can.
No, not anymore. It's been reversed.
Okay. Well, that's good.
Yes.
The little things, but a lot of the times then you like at the same time, there's like tons of little, like, if you have a healthcare provider who truly disapproves of who you are, like as yourself, I would imagine things would just be miserable, like absolutely miserable.
I mean, I've had a healthcare provider try to send me to conversion therapy. So,
oh my gosh. I am
like,
sorry.
options.
No. Yeah. When I started asking, so one of the questions that I usually ask my patients when I was just doing so I worked in primary care for 3 years. And one of the general things of just like that first get to know you visit, when you're asking like all the awkward questions, and this is, I guess, to anybody who ever has to encounter like patients where you're asking like intake of questions where it doesn't have to be super duper awkward. Cause I feel like in school you sit there and you practice and you're like, okay, um, do you happen to be attracted to, and it doesn't have to be like that, friend. Like we can really make it a normal conversation when it's like where we can just say it. And the way I usually go for it, Scott.
Oh no, I just wanted to chime in. I've always worked at hospitals that have like anti-discrimination policies, because we're talking about state law, but then we're also talking about institutional policy. And then we're talking about like the profession and the ethics of the profession. And the ethics, the way I learned them are that you treat each patient as a human being, give them the best care you can, regardless. Then at the institutional level, if you were to refuse a patient, it's like, no, I'm not taking care of the blankety blank. I would imagine that could get back and you'd be in violation of your hospital's diversity statement. State law, notwithstanding. I don't know. I just want to point out there's several levels to.
Yeah.
And you refuse a patient.
It depends on your hospital's diversity and like inclusion policy, because I've been to a couple hospitals that gender and sexuality aren't even thought of in an inclusion policy and a discrimination policy. You
need to start a what is it? The inclusion and it's a trend right now.
Diversity and inclusion. Yeah.
I do want to make a comment on this whole general topic. There was a case out of Michigan where there was a white couple, had a baby, and they were refusing nurses who were black. And so the hospital went ahead and pulled them off the case without asking them. And from a healthcare standpoint, I want to address this in a few different ways. One, that's illegal. That's a case that the hospital lost. Being under EEOC, customer preference is not a reason. Whether that means you're gay, because if they don't want you because you're gay, well, you can say, hey, look, they can not want me all they want, but that's sexual discrimination. That's not allowed. If it's because you're male or female, that's still sexual discrimination, whether it's color, religion, any number of these. There are a number of things that are covered under Title IX or Title VII. Don't remember which off the top of my head. That said, if you choose to refuse being moved off a patient, if you're asked or if you're told, two things. One, I would strongly recommend contacting a lawyer just so that you know and cover yourself. And two, if you are dealing with a patient that you know is going to be hostile and you're approaching this intentionally, make sure to CYA. Because, have somebody to back you up, because there are going to be problems that arise.
And sometimes, go for it. I was going to say sometimes that I just would let them just leave. You know what I mean? Like that's not going to be someone that you want.
Yeah, there's a balance between accommodating a patient and also customer service being all important now to hospitals. There's and some things like, a woman from a certain culture comes in and she wants a female doctor to examine her. And, it's one thing to go, hey, look, lady, you get the doctor you get. Our doctors see men, women, everything. And there's nothing about, and then there's also respecting the culture that woman comes from and trying to accommodate her. And that's sometimes a difficult balance. But, if it's, sometimes you do it just, I don't want that nurse. I don't want to take it. That's fine. It's just easier to switch them out. Look, your patient's an asshole. He wants a different nurse. You take this one, you take that one. Everybody go on with their day. you know,
And
choose your
people
battles.
aren't shy about it.
Yeah, like I'm like, why am I gonna sit here and fight to care for this patient that
Yes.
is just gonna be awful to me the whole time
Yes.
anyway?
That's what
And like
I
that's
know.
like
Well,
that's
and you blow
the
the
sad other side of it, right? Is like
Uh-huh.
it is my right and to like care for the patients I've been assigned, and like I know I can provide good care, and like maybe this is even an opportunity for me to show them like, hey, like I'm queer, I'm trans, but like I'm a good person, I'm good at my job, I'm gonna take care of you, and this could be their first positive experience. But when you have 5 or 6 patients, you're not gonna argue this. You're gonna be like, fine, I'll take the other one. That's
Exactly.
and
Exactly.
you're not really there to change minds one patient at a time. You know, you're there to give healthcare, and you've already blown that rapport. If they're like, I don't want this nurse, even if it's just because you were rude to me, I don't want this nurse. You know, you don't have that rapport anymore. Anything you try to teach that patient isn't going to be heard. Any advice you give isn't going to be received. So it's better really for the patient care than to just switch. But as far as, you know, I've worked in different parts of the country, but I haven't had that many people. I mean, I've been called every name in the book by the psych patients, and it includes some sexual orientation slurs. But I kind of figured they would call anybody that, because I mean,
Mhm.
I think it's obvious that I'm gay when I walk in a room, but apparently other people think I can pass. So, and I get plenty of little. Well, this happens less as I get older, but it's like, oh, honey. Well, first, when are you going to be a doctor? No,
Uh-huh.
I'm
Yeah.
already what I'm going to be when I grow up. I'm a
Yeah.
nurse. It's a thing, and so. And then, you know, it's like, are you married? Do you have children? Oh, do you have a girlfriend? I'm like, look, I'm really not. I just say no. And
Mhm.
every once in a while, I think I would throw in there. It's like, well, no, I don't date women, and just kind of
Mhm.
see where that lands. Um,
Mhm.
but you know, maybe it's also the patient population. You're in an emergency room. You're really focused on yourself and what's going on, this unexpected illness or this injury. So they haven't had time. They're thinking more about that than anything about the person taking care of them. But
Yeah.
you just choose your battles. I mean, you know, most of the time I'll let it go. They call me a name or anything. I'm not on team bold or blunt. I'm
Mhm.
on team just let
Mhm.
it go. Let them, you
Mhm.
know, just
right. I think it depends on the situation, right? Like
yeah,
obviously,
oh,
if
yeah,
it's a patient who has altered mental status, I'm not going to be like
Mhm.
now, like
Yeah.
yes, obviously, like they're not coherent. We're not going to be like having life lessons to learn.
Yeah.
Like, you know, my dementia patients, they can think I'm whoever they want to think.
Uh-huh.
But like right now, the unit that I'm on, like they're surgical patients, and they're usually with me for 2
Mhm.
to 7 days, and we
Yeah.
try to give the same nurses so that they have consistency of care and they know what to expect. And so if something does come up and you have to like shuffle it around, and maybe there was another
Mhm.
patient who was expecting to have the same nurse, but now all of a sudden they have you. And so
Mhm.
it's, you know, and I can't imagine the charge nurses having to figure all this out.
No.
That's what I'm
No.
grateful I
It's
don't charge.
literally the worst. Literally the worst ever. And I think some of it is probably cultural too, because I grew up on the West Coast and then I moved to the East Coast where I live now, but I've also lived in like North Carolina. And I was much more outspoken and protective of people in North Carolina because people were so outspoken the other way. You know what I mean? Like where I was just like, no, like we're going to, I felt like in California, like I grew up in Southern California and it was like that was just like not a thing as much that it was like a thing. And then in like in North Carolina, when I had patients that I would ask like, oh, okay, in romantic relationships, are you interested in men, women, or both? And they would like people who were not they were or like yeah people were either highly offended or were like no one has ever asked me that and I have never told like I'm like I've never gotten help. I've had patients say that they've never been able to get like prep or anything because they've told their doctors before and they were just like, well, I don't support that, so I'm not going to give it to you. And I'm like, okay, like
bad medicine,
okay.
bad medicine.
I got a very interesting reputation where I lived before because I asked everyone if like about all of this stuff. So I had a bunch of like patients who were young, a lot of LGBTQ patients and a lot of teenagers who just wanted to know. They didn't have a lot of education around like anything. And the physician I worked with, she's like, "What? Your patients are all like, what is happening?" I was like, "Just don't worry about it. We're just
Oh yeah.
Fine.
Listen, I won't lie. I have friends that lived in Raleigh, and like I watched
Mhm.
all your videos getting through nursing school, and I was like, oh, I'm all alone. And like, but like I had friends that were living there, and they'd be like, I can't find a good nurse, and I was like, okay. And I was like, I would try to like figure out where you worked so that I could like send them to you, and I never could, but like I was like, oh, there's one person I don't know where she is.
I hide under my rock. I know. But it was just so sad to
I
me
think
that they
that's
were
a good
like,
point, Liz,
mhm,
about asking personal questions, including like
mhm,
sexual and
mhm,
attractive and identity information from patients. And it all, to me, this is when I, in all my years as a nurse, this is what I've learned. It depends. I can ask a little old lady about, her
mhm,
STDs and her sexual history if you do it
mhm,
the right way. And the one
mhm,
thing is to let them know why you're asking. Because it
mhm.
sounds to a
Yeah.
patient a lot of times like we're just being nosy. Like they want to know everything. Like, how color is my
Yeah.
stool? And who do I have sex with? And
Yep.
what the hell?
Yeah.
I'm here because I, broke my leg.
Yep.
And I think so. First of all, that, and then we've made a change. I don't know if it's made it all the way to the southeast, but we've made a change in asking, are you gay, straight, or bisexual, or are you attracted to men, women? Because in healthcare, that's not what we care about. I don't care who you're attracted to.
Mhm.
I don't care how you
Mhm.
identify. But I want to know, do you have
Mhm.
sex with men, women, or both? And do you use
Mhm.
protection when you do that? I
Mhm.
don't
Well,
care
and
if you
those aren't
identify,
even
because
accurate
there's,
questions.
Mhm.
If we think about it, because there are men that have
Mhm.
vaginas and women that
That's
have
very true.
penises.
That's a
And
really
so if
good
we
it's
point.
ask,
Yeah.
becoming
if we
more,
ask about
yeah,
the genitalia of your sexual
Mhm.
partners, then we actually
Mhm.
learn more.
yeah.
Mhm. That's a
We'll
very good
probably
point.
move to that. I just had a friend who's trans. I had her go over my script for that video that I made. I'm like, do I say anything? I put my foot in my mouth? Have I, done anything?
Mhm.
And she gave me some pointers. And she's trans, and her partner's trans, and she is male to female, and I think her partner's non-binary, but has a vagina. So yeah, we do
Mhm.
have to start saying the people that you have sex with, do they have penises, vaginas? Well, I can't say both, penises or
Mhm.
vaginas. Do you,
Yeah.
instead of because there are straight men who are like, no, I'm straight, but I fool around with guys.
Mhm.
So they would
Mhm.
identify as gay or bisexual, but when you ask that question, you get the answer that you can use for healthcare reasons.
Mhm.
Right? And like you
Yeah.
said,
And that's a
explaining to
really
them
good.
why we need to know that. Like we need to know
Exactly.
we're prone to more like these specific illnesses that have higher rates because of the genitalia in this situation.
Exactly.
It's like we need to know if you are using protection and what kind of protection, and
Mhm.
if you're using it all the time or like
Mhm.
just most of the time. Like,
Yeah.
Mhm.
So, ma'am, do you have a prostate? you
Yeah.
know, we need to know these things because
Yeah.
that doesn't get removed even if you have bottom surgery. Um, and it gets. When I first came to San Francisco as a traveler, I was at an ER, and there was a woman, male to female, transgender patient who had prostate enlargement. And I found myself saying a sentence I thought I'd never say. Hi, ma'am. I need to put a catheter in your penis.
Mhm.
But that's the reality of the world. To me, it was
Mhm.
new at the time, and that just sounded very strange. But we have to get used to the fact that all this stuff is interchangeable. You can have a vagina or a penis, or you can be identified as male, female, non-binary. It's just something we all have to get used to, and it's going slower. It sounds like in the South, which is,
Oh, it's
but we
crawling.
need
It's not
strong.
something
We
that's
need strong.
introduced in school. It's
oh, I had to teach it in nursing school.
yeah,
Well, let's
I
put it
bet.
this way. I offered to teach it because actually before I went to nursing school, I have a background in social work, and I was doing consulting with companies, with police departments, with healthcare organizations on how to be more inclusive in their paperwork and their practices. And I
Mhm.
offered to like teach the LGBT section in my
Mhm.
nursing school because there
Mhm.
I looked over in advance the PowerPoint and I was like, this is very wrong. I can give you a
Oh.
PowerPoint. And they turned me down. So then I just sat through the lecture and raised my hand and interrupted them and gave them the correct information.
Mhm.
Like my nursing instructor in 2019 tried to say that trans people are like literally delusional that we don't know what body parts we have and that's why we don't get care. And I was like, no, it's because you people like you who
Mhm.
don't think we're sane human beings and don't give
Mhm.
us adequate care, and we don't want to deal
Mhm.
with that to our detriment.
Mhm. Yeah.
Good on you for speaking up in your class, though, because those
Oh, for
nurses
sure.
now, it's like, I mean, I was out in college in Southeast Missouri and in the late 80s. And I now have fraternity brothers who are teachers who are amazing allies. It almost brings me to tears, some of the stuff that they do as teachers to try to bring awareness to their students at that level. And I'd like to think I had a little bit of influence on that. So by being out and sharing your experience with your fraternity brothers or with your nursing class, that has little roots that spread. And I'm gonna kind of out my nephew. I have a nephew who's a nurse in South Carolina who is also gay, who tells me stories of the trans teens that come in, usually like for a psych emergency. And I always wonder, I'm like, why are you working in that part of the country? You're a nurse, you could work anywhere, really, and you wouldn't have to deal with all that crap. But then he tells me stories like that about these kids that come in and their whole family and their teachers and everything they've ever heard about being trans is that it's wrong. You should try to change it. He's the first voice to pull them aside and go, hey, look, I know your parents, what your parents have said about this, but it's okay. You're not wrong. You're not crazy. You're not alone. And he's the first time that, I said, you are the first voice to ever tell them that. So maybe we need you to stay in South Carolina.
Yeah. That is a really good perspective.
If I wasn't so
quarantine at a time, because he's saving lives.
Sorry.
Yeah.
Oh, go ahead.
You said you would have stayed. Yeah.
I would have stayed if I wasn't being physically attacked regularly, like I got to a point and like I had a major breakdown about it because I was like, but I have to stay and I have to help people. And like, I'm gonna like, I can't let more people die because they grew up thinking like I did and everyone attacked them like I experienced. And like, I need to be there. But I was like, but I also need to be alive.
Yeah.
And that's a really hard decision to make when you're a nurse, when you're someone who wants to help people so much, and that is so much of who you are, to have to step back and take care of yourself.
Yeah. And be like, I can't do anything if I'm not, if I'm feeling like I'm being like abused all the time. I wanted to get this question really quick. So OB nurse Chelsea, she was on her, you guys know her, Zan, you don't, but we were talking with her on Tuesday or Monday. She said, what would be a good way to address this with patients? I think she was talking about like, who do you have relationships with, especially since I do work directly with reproductive organs, lots of assumptions are made about our population. I try to ask something like, is there anything about your identity, gender, or sexual orientation that would help me take better care, more respectful care of you today? So she is a labor and delivery nurse as well. She's going for her CNM to be a midwife as well. So if you guys have any thoughts on that.
That's originally what I wanted to do. Sorry, go ahead.
How I would approach this is, and granted, I don't work in this field, but to me, knowing both who you have sex with, how you have sex, and what type of sex you have puts you at risk for a lot of things. And I would explain it just like that. These are healthcare information things that let me gauge what risks I need to talk to you about. So, if you could tell me, how many partners do you have? Do you know if your partner or partners have other partners themselves? Do you practice?
Oh, no.
Refresh.
We'll send good vibes that way.
We need to.
We're trying to reflect the Wi-Fi signal.
Let me send it over your way. Do either of you have any thoughts?
That's what I was saying. Yeah, what I was saying before about you need to let them know why. I forgot to mention I'm getting my master's to be a family nurse practitioner, and I'm already like rehearsing like what I'm going to be doing in that role, including like, okay, how would I do this and say, well, okay, hey, I'm glad you came to see us today, came to see me. One of the things that I do, one of the things in my role is to help you with things that you're at risk for. If you're at risk for diabetes, or you're at risk for heart disease, or you're at risk for STDs. And so that's why we ask some questions that are kind of personal sometimes. I want you to know that it's confidential, that I don't go, talking to the other people here about it, and that there's a reason that we ask. So, when I ask these questions, I want you to share as much or as little as you feel comfortable with, but know that I want to be someone you can trust, and that I have a good reason for asking this. And if you have questions about my reasons and all that, we can talk about that too.
Yeah. So
that's amazing. Yeah.
Yeah. So one of the ways that I usually did it, in primary care, and obviously you don't have to do it this exact way, is the first time I met someone and we sat down, I said, today is mostly going to be you getting to know me and me getting to know you. This relationship is just as much about I want you to trust me. So I want you to know, like, I didn't share a bunch of stuff, but I gave them a page when they showed up, and it was just about me, what my background was. It had my pronouns on there, that I had a husband and 2 small children, and like blah blah blah. I like have 8 million hobbies because I have ADHD, and like, all of these things. So they kind of could read that while they're in the waiting room. And I said, if you do have any questions, like, feel free to get me. I want this to be a good fit where we work together. And then I would say throughout this encounter, like throughout today, I'm going to be asking you a lot of questions so that I can get to know you, because it's my job to keep you and your body as safe as they possibly could be. I said, so we're going to, and some of those questions are eventually going to get a little bit more intimate. I'm going to save those for a few minutes while we just have small talk about your blood pressure before we move into some of those other topics. And keep in mind that this is all because this is what I'm doing. I'm going to figure out what we have to screen to see, is it misbehaving, anything like that. I said, so if at any point you feel uncomfortable, please let me know and we can approach it a different way. And then we would kind of start with little things like, oh, what does grandma have? What is this? And then before we started talking, I'd be like, okay, we've kind of laid that foundation. Now we're going to like really get to know each other. Okay. We're going into we're second date territory now. And then I would be like, this is important for me to know, because I need to know what your just practices are, because some of our care might change, and I can, we want to keep you safe. And then I said, just practices are, because some of my care might change.
Sorry.
I'm like, oh, inception.
Feedback.
And then I usually just asked, is it okay if I ask you some questions about your sexual orientation and some of your romantic relationships? And pretty much if they said yes, if they said no, I said, okay, that's fine. But that's going to be difficult. Here's what we could, I think I only had one person ever that said no. And I just said, that's fine. Here's why I wanted to know. Ever change your mind? Go ahead.
Maybe we'll talk about it later.
Exactly. And then I would just start asking. I usually phrased it as, when you, in your romantic relationships, do you have intercourse with men, women, or both? Or are you are you romantically involved with men, women, or both? Yeah.
Let me stop you because sometimes having sex has nothing to do with romance.
That's very true.
So ask the question you want to know. You don't want to know if there was romance.
True.
You just want to know who they had sex with.
Oh, well, then I did ask a lot more questions. That's usually my starter was, are you interested? No, that's a very good point. Yeah.
There's an assumption there. I just want to challenge.
Mm-hmm. And I think Zan said too, even that question implies different things. So I would start it with that. And then I would usually ask, what organs are we involving in this? And then we would have a whole diagram of our whole body. We start pointing to everything, mouths, vagina, using all the technical terms, and kind of going from there. What type, how often, how many people? And that opened the conversation in a more gentle way, in my experience. Obviously, there's a lot of room to improve there, because I probably could change the way I talked about that, just in terms of men, women, both, all of that. But that's how I did it. That's not by any means the correct way, but that usually did make people slightly more receptive to okay, this is so not out of the blue. Or you're not bulldozing me with all these weird questions.
Or even the question, do you have sex with other people, since there are people who are either celibate or asexual, or, define their sexuality in some other way. So are you sexually active? Which, the old story, the old joke about that. One of my doctors told this when I was a new nurse. She asked a patient, are you sexually active? She said, no. And she said, do you have, some other question, do you have, when's the last time you had sex? She's like, yesterday. She's like, well, I don't mean, are you sexually active right now in the chair? I mean, are you sexually active? She's like, you got to be careful how people receive the questions that you ask,
I honestly, I stopped asking it
or the other one.
Because of that exact thing.
Yeah.
Or the other one, are you sexually active? No. And the doctor's like, oh, so you just lay there?
Yeah, I stopped asking it like that, because people were like, if you said that, then people were like, well, no. I'm like, but you have you've had a C-section, and they're like, oh, well, a long time ago. I mean, well, kind of last week. And then, or you could be like, oh, have you ever had sex? And they'll be like, no. And your same thing. You're like, okay, but how did this happen? And they were like, oh, that doesn't count. And I was like, I'm just going to rephrase how I asked this question.
A lot of people don't think of sex outside of a penis and vagina kind of situation.
Exactly.
People in the LGBT community are acutely aware of that.
Yeah.
But I think one other suggestion I would make, especially in primary care, where you have an opportunity to have forms to get to know each other and like maintain a relationship, is one thing I've always liked is having a form to fill out. So that way you don't have to
Yes.
like have that conversation
Say it.
necessarily. You're not like, I have sex with all these people and this is how. And like it feels a lot less scary to like mark some check boxes, or like honestly, like check boxes are good, but always leave us blank for like other, or please like other explanations and things like that. And being careful, right? Like we need to transition from saying men and women, and we need to transition from talking, I think polyamory is like a big practice within the LGBT community. So like being aware that you might have multiple relationships, and some of them might be romantic, and there might be more than one that's romantic, and there might be an open relationship where they have sex outside of that, and just kind of keeping these things in mind so that you're not like, the worst feeling as a patient is to have the person you're talking to, who's supposed to be a professional, make a face.
Yes.
And like we've all been in that
uncomfortable.
Right.
Yeah.
Right. We've all been in that
like,
situation where we're like, oh, that's a new thing no one's ever said to me before. And you have to like poker face real hard and be like, great. Okay. Thank you for that information. And, but like trying to like come up with those as much as you can just in general practice so that you are prepared.
And I think that's a really good point. I'm a huge forms are great. I love forms. I feel like my patients were overwhelmed with how many forms I shoved at them. I'm like, here's all my feelings. Here's all of your feelings. Let's combine them. Like, because you're right. People feel so much more likely to disclose whatever. And it's just an easy way to get information, like sex assigned at birth, gender you identify, like gender you are now, like all of that type of stuff. You can just plop it on there and you're like, okay, this is perfect. Like, here we go.
Right.
As a patient, I don't like filling out forms, but as a practitioner, I understand that they're necessary.
Well, maybe giving your patients the option, right? Like another thing that's like a larger thing in the medical community is like keeping in mind how our patients learn best and asking them, are you a visual learner? Are you an auditory learner? Like I always have to make sure that any instructions for any medications or whatever you want me to do, you better write it down and send it to me in my chart. And like, I need it in 3 different places written down. Videos would be great if you have them. Like,
I have to challenge that though. That's what we've always been taught is, what kind of learner are you? And the research that's coming out now is showing that there is no such thing as a visual learner or an auditory learner. We are all visual learners and auditory learners. And so we all learn through all those different channels. And there doesn't seem to be a preference for one as far as retention goes. People may like to learn better through one medium or the other. They'd rather see a picture than read, but the retention is the same. So I guess the takeaway is give them all. Give them everything. Give them pictures, give them words, give them links to the internet, to videos on the internet, talk and have discussion and return demonstration. Just do it all.
And I think also one of the most frustrating things that I've personally experienced is when a practitioner expects me to educate them at my appointment. That is the most frustrating. And I usually leave going, why did I pay for this? You should be paying.
That is a topic I covered in my video.
This. Let me go research it, and at our next appointment, I will be much better, like equipped to have this conversation. I'd much rather them say that than be like, "And what does that mean? How are they pronouns used?" I'm like, I get paid to do this work usually.
Yeah.
That's the thing, though. I talked about that in my video, and I'm not trying to promote my video. I don't care if you guys.
No, please do promote away.
But if you feel like it's something you want to watch, that's fine. But my advice in the video and to you all now is that if you are LGBTQ, if you're somewhere in the rainbow, and you go to your doctor, first of all, it's always your right to say as much or as little as you want to disclose. Okay, there are good reasons that your doctor or practitioner wants that information. So listen to them and consider that. Check them out to see if they're a reliable, reasonable, trustworthy person. Hopefully they are. And then consider training your doctor. You don't have the obligation to do that. They have the obligation to learn how to give appropriate care to all different types of patients. But the reality is a lot of times they don't. And if you feel like you're in a place to educate them even a little bit, consider that. I understand that when you feel like you're forced to, you're like, wait, who should you pay me for this consultation, or should I pay you for the medical visit? But I was brought out as a gay man with some sense of obligation to the community and giving back. So knowing my history, knowing our history, being out whenever I can at work or with friends and family, and educating my doctors. I've had doctors who didn't know. I had a doctor once who I had seen for some time, and I made some comment about top and bottom, which is the slang for the gay man who inserts into the other man and the one who receives the penis from the other man, just as long as we're being medical here. And so slang, that's top and bottom. And I made some comment about that, and my doctor goes, so that's what that means. I'm like, yeah, that is what that means. And she's like, I've heard that before. I was never sure what that meant. I'm like, well, that's what it means. You got top and bottom. So it could be a little thing like that. I've been very comfortable with my doctors, as you can tell.
Well, that's what we want. Yeah.
Well, they've been worthy of my trust. I've had other doctors. I was like, one and done. I'm not going back. But the ones I've stayed with have been trustworthy. And so you don't, as LGBTQ plus people, don't feel like you're obligated to train your caretakers. But if you do, that's okay too. And it does maybe help the next patient that comes to that person.
I think it also depends on how much too. Like, it's one thing if they're like, oh, what's that term mean? And it's one thing. But when they're asking intimate questions about how I have relationships and who I have sex with, and I'm not even using slang, and they don't know these, like, I'm like, I can't spend our whole 30-minute appointment teaching you these things. And so, like, I usually will go with links and be like, if they ask me questions, be like, here's a sheet of links. Like,
that's great.
Good things. But like, I totally get it. And I will totally, if it's like one or two things that just happen to pop up, of course, I'll explain. That's no problem. But like when
it depends on how you feel. If you're there because you're sick and you're in pain, you're like, look, now is not the time for me to explain to you the ins and outs of gay culture. I need my belly pain taken care of. And
if I'm in the emergency department, now is not the time for, like, I just had a head injury and now you're asking me about polyamory. And I'm like, I would really like a CT scan, please.
Oh my gosh.
And I see that Jonathan, who commented there, said he was doing a little of that too.
Yeah, I was going to say, it sounds like a lot of the time this is kind of the burden is falling to the people who are the most affected by it, rather than like other people feeling like they should probably just educate themselves. Jonathan said, I used to teach LGBTQ plus equality classes for my unit in the military. No one else felt comfortable teaching it. But go you for actually doing that, especially in that environment, which I can't imagine would be super. I mean, maybe I'm wrong. Like,
there's a lot more LGBT.
You'd be surprised.
Oh, good. Okay, that makes me happier to hear.
It's gonna sound. This is my personal opinion, but when our country doesn't have social systems to support people who are housing insecure and are like the most discriminated against, when you're at those intersections of being discriminated against, you have no other employment opportunities. And so if the military will take you, then they'll take you.
Plus, the military has historically been a place that has, by necessity, thrown people together with differences. It did a lot towards improving racism in the country, because in wartime, you don't care if the guy behind you is black or white, as long as he's got your back when you're being fired at. And you come out of that experience going, hey, this guy, the black guys in my unit, I could count on them. They were my brothers. Anyway, so because of that, I think I've heard some stories too about sexual orientation. Like, look, this guy was in our unit who was gay, but we're all being fired at by the same enemy. So
But I think it'll also depend on, like, are you in a war situation or are you on a base too, right? Like, there's a lot of assault cases that don't get investigated against LGBT people in the military. But again, like, this is, it depends on like who's in leadership at the time, right?
It's just such a very weird thing for me that was an issue. You know what I mean? Like, what you're doing in your downtime, like, I don't understand. Megan said I was in boot camp.
Go ahead. Sorry.
Oh yeah. No, I mean, I understand it, but I just like rationally, I don't understand it. You know what I mean? I get where it's coming from
Mm.
in terms of why, it's heaven forbid, you gay people, you're going to
Well,
take
if
over
I
the world
could,
and we can't
it's
have
the
that.
fear of the it's the fear of the
Yeah.
unknown. You're this other. You look like a regular
Mhm.
guy, but now you told me
Yeah.
you're gay. So
You're almost
what
as
does
dangerous
that
as
mean? Does that
women.
mean
So
yeah? Well, does that mean you're looking at me like with lustful eyes? Or are you like catching glimpses? Or do you if we're in a tight corner somewhere, are you going to try to kiss me or whatever? So no, by the way, being gay means you're attracted to guys, not all guys.
And
And
usually the ones
probably
that
not you.
are also me. Like if you're really homophobic, I'm not gonna be trying to make out with you. I'm gonna be
Nah.
trying to get away from you.
But it's the unknown. It's like if anything that's unknown. A foreigner from a foreign country, you go to a foreign country. What are the customs? What are the laws? How do people behave? How close do they stand when they talk? So it's the exposure that we give people when we're out of the closet that helps, and exposure on television and in the movies and in sports and everything else now becomes not an unknown other like the boogeyman. Now it's the two girls that live down the street that have that nice garden and the dog, and the guy that that's a stereotype.
Yeah.
I was gonna say the guy that does my hair, but that's such a stereotype. But my car mechanic is gay or whatever.
And your doctor, your nurse, your teacher, like where it's just
you
like
see
okay.
that all these bad ideas, right? Like we're told that like gay people want to abuse your children, and we're all trying to like abuse children, and it's like no, like
You're in the
I want to be
bathrooms
a
constantly,
pediatric
apparently.
nurse so that I can help children.
Yeah.
That's the biggest thing that I think, one of the biggest things that hurt the gay community in the 20th century is this, and you can actually watch these old 1950s educational films on YouTube about, this is Gary, and he's befriending young Tommy because he has a mental illness called homosexuality. I'm like, no, Gary's a pedophile. So that confusion between homosexual and pedophile has been the biggest, because pedophiles are a problem, but they're not the same at all. And so there's some overlap, but most pedophiles actually that you see prosecuted are straight, are heterosexual. But that confusion has caused so much fear. It's like, oh, these gays and the kids are trying to indoctrinate your kids. Like, I lived most of my life without any kids in my life till I became an uncle.
Right.
And I don't want to have sex with kids, and none of the people that I know want to have sex with. It's just been such a terrible, terrible.
Right, and now they're trying to legislate that like you can't have like drag queen story hour with kids, and it's like.
My mom asked me about that. I talked to her. She's
like they don't care.
Okay.
They're just, this person's fun and is dressed up and is really like has a cool voice and is reading me a story, and like kids don't care about that. And honestly, like when you talk to kids, like I've been a nanny for years, and like kids totally get that I'm non-binary. I'm like, no, I'm not a boy or a girl. I'm just a person. And they're like, that's cool. What do
My mom
can I have a French fry? Yeah.
So, are you going to make me for lunch?
Yeah, exactly.
Exactly. Like,
can we go to the park now? Like,
do you know I have boogers in my nose? Okay, great, cool. Like, that's about where we are.
And then we have great dress-up time.
It's the fear of the unknown again, because like I told my mom, you think kids should be exposed to that? I'm like, exposed to what? They're basically a clown. They're an adult with makeup on reading a story. They're not indoctrinated. They're not now that the drag queen's here, we can talk about how you can become gay too, or what. So my mom had all these things in her head about what it might be, and it's not. It's a clown reading a story, basically. So nothing to be fearful of.
The best example that I have for that is, if you're so worried about trans representation or gay representation and it affecting all these massive people, well, like, how many straight relationships do you see on TV or in shows? And, like, if it is so effective that, this representation matters, why are there so many gays out there right now? Because, 20, 30 years ago, this was not a thing, unless you're watching Golden Girls, or unless you're watching, this one or other specific show, and I understand the idea behind the Don't Say Gay bill, right? That, there are subjects that should be, taught responsibly to kids and in a way that they can understand. But I don't think it's that hard to say, oh yeah, that's, you know, he loves him or she loves her or they love each other and that's why they're together. Because quite frankly, you know, if you were so concerned about talk about what happens in the bedroom with kids, you know, like, are you thinking that this happens with straight couples? It doesn't.
Yeah. No.
You know, like.
And this overlaps with sex education, and I had a conversation about this too. Like, should kids in kindergarten be taught all this stuff? I'm like, sex education should always be age appropriate. In kindergarten, you're going to have like pictures and you're going to call parts of the body by name. You're not going to talk about what's involved with STDs or how different people have different types of sex or how to protect yourself or birth. It's all age appropriate. And telling somebody, hey, you know what, some people have sex with people that are the same gender as they are, is not advocating it. It's not saying you should do it. It's not saying that society accepts it. It's just a fact. But
it's a fact.
You know,
that's what I don't understand people not comprehending. Is like, I think one of the biggest issues with discrimination against the LGBT community is like, it's not necessarily a visual thing, right? Like you can't necessarily look at someone and be like, they're gay. Like that's, but like when it comes to race, obviously, like you can be like, oh, that person has darker skin, and like, and so it's like a visual cue. But when you have something and and people just have to take people's word for it. You have to believe that I'm queer and trans because I said so. It's a lot easier to be like, that's not a real thing. They're making it up.
It's an invisible minority. And if you want to, not the place here, but if any of the viewers get into like deeper discussions of the gay experience and the queer experience, being an invisible minority is a challenge. Also, being a different minority than your family of origin. Black kids usually have at least one black parent. Gay kids usually have two heterosexual parents, and so
there's no parents after a while.
Sometimes they're disowned, and that's a terribly, terribly sad thing. Yes, but that's just because you can't see it. There's a lot going on that you can't see. Right. But I don't want to far off course for the discussion here about healthcare and patients and providers.
It's very isolating.
Well, and
you're right.
Oh, for sure. And I think I was going to say that part of the issue, there was back when the Don't Say Gay bill thing came out, people were like, oh, well, don't talk about it. I was talking about it. And people were like, that's not like related to whatever, like healthcare, whatever. I was like, it is, because it's literally mental health. Because if you are telling someone that like, we're going to hide this, like you can't talk about it, that's inherently telling people that this is bad. I was like, so I'm not grasping.
Well, and I'm not saying I got decent sex education in my public school anyway. In fact, I don't recall getting any sex ed other than you don't have sex. We weren't even told what sex was. But then like,
don't have it.
But like, if we're
more coming up on that soon on my channel,
comprehensive sex education, then like not including how to have safely have sex with someone of the same sex is inherently causing health issues. If you're not educating people on how to be sex, they're gonna do how to be safe during sex, safer. Then you're responsible for the STIs, the trauma, whatever happens, for not discussing it.
Oh yeah, we have a whole. I could go on an epic rant about that. Go for it.
I want to take somebody in the comments. Surgery Studio says something about the actual curriculum proposed is inappropriate. They say they want to teach kindergartners about masturbation, which isn't something you should discuss with a child. Like most of this, people don't know necessarily. I don't know what you know about your curriculum that you're referring to, but most people don't really know the actual curriculum, and they assume certain things. Do they discuss masturbation? Maybe they discuss that it's okay to touch any part of your body. That's okay. That there are no dirty parts of your body. Your hand, your face, your penis, your foot. They're all just parts of your body. Now, that's not teaching them how to masturbate, but I think people could interpret that as, oh, they're teaching them about masturbation. It's okay to touch themselves. So be very careful when you're making those critiques, because if they're doing it right, now if they're actually talking about masturbation, you need to go to the school district. Because kindergarten is not the place.
No,
but
that's definitely a conversation you can have
it's
at
easy,
home, right?
It's easy to read too much into it.
Yeah. yeah, and we don't need to overstretch it to all the sudden, because like my daughter's almost 5, and it's been very simple to have the conversation of my husband's mom is married is to a woman, and so they have only ever known two grandmas, and it is not difficult for her to comprehend, like, okay, we have grandma, grandpa over here, grandma, grandpa over here, grandma, grandma. Like, it's not, because that's all she's ever known. So she's just like, I get more presents. Cool.
Right.
Like, like it's the exact, like, it's just not even weird. And so I
have
think
more
that's
people
the
in my life that love
frustrating.
me.
Exactly. Exactly. She's like, I like grandmas. I have like 12. And you're like, yeah, yes, you do. But I think, yeah. And I wonder, like, I do wonder about that. Like, I've seen that, like, oh, what it's in the curriculum. And then that brings up, like, yeah, how are you? Like, I would love to see what was actually in the curriculum. And, was it something that was saying, hey, like, and how does that fit in with other? I don't know. Like, was it interpreted as, I don't know.
If there are
Hey,
certain parts of your body you touch, sometimes you have to make sure you wash your hands before and after.
uh-huh. Hey, that's
what I
what,
tell
exactly. That's
you.
kind
Some
of a,
places, when you
hey,
touch your body, you should do that in private.
exactly. There's places on your body that you can touch and it feels really, really good, but we
Yeah.
do that in our bedroom, usually by ourselves.
Yeah.
But that's not
Later,
that, even
you're
that
going
is
to
not
do that with other
kindergarten.
people.
There,
Yeah,
you tell mom,
exactly.
dad, or whatever.
Yeah.
Well, you jump from kindergarten to an upper level, because at kindergarten you just want to say all your body parts are good. There's no bad body part. Then maybe in higher grades you can say, there's certain, if you touch certain parts of your body, it feels good.
Mm-hmm.
And you do that, or any other part, that's fine. Just do it privately.
Yeah.
You want to be careful not to be teaching values, because that's the parent's job. I get that, but just general information and making it always, always, always age appropriate.
For sure. So I don't know how that got, like, yeah, if that was all in the bill, like, because I agree. Yeah, we probably shouldn't be doing a demonstration for 5-year-olds.
Right.
But
I totally
that
agree with Wilfredo
does,
also. Like, if they're asking the question, then they need some sort of answer. The most frustrating thing to me as a kid was me asking the question, people being like, I'll tell you when you're older. And I'm like, but I want to know. And now I'm going to go ask other people and I'm going to get an answer that you don't like.
And it's so easy. Like, it's so easy because they're just so easily satisfied. They're like, we have already had many conversations.
Their questions. It's just because
how do babies get in there? And you're like, well, like this plus this.
Same way they come out.
Exactly. This and this makes this. And they're like, that's great. Okay, bye. Like, it's, yeah.
Well, it has to do with the parents' comfort in talking about those subjects too. And if the parents are uncomfortable, they're certainly not ready to teach it to a child. And we still live in a society that there are people that you just don't talk about certain things. And I don't even want to think about certain things. I mean, thank you, Steph. I appreciate that.
Also, Steph's my fiance, and so I'm very glad that they're here.
Oh, really? Excellent
Nice
job.
to meet you.
She said, Scott's correct. Children should be told there's no part of their body that's wrong, dirty, or bad. There's a difference between that and teaching masturbation, and that's very, very true. I will say, as a parent of toddlers, you do sometimes have to earlier on tell them locations of your, not the middle of Target, my darling.
Oh, yeah.
We can talk
usually
about that
more
when we get home.
Usually more in our bedroom.
Yeah.
Just not in the middle of the Walmart floor, please.
Yeah.
I hate to make a screeching left, but one topic that I did want to talk about that I feel is really undereducated among healthcare is PrEP and HIV medication.
Yes. Yes.
Because the vast majority of HIV patients, actually all of the HIV patients that I've had are straight, which is something important to remember, that, this is not just a gay thing. And when it comes to PrEP, this is not something that you just want to talk to your gay male patients about.
Can you explain what PrEP is for those who don't know?
Okay, so PrEP stands for pre-exposure prophylaxis. Currently, there are 2 drugs that I'm aware of on the market. One is Descovy, one is Truvada. Truvada is a little bit older. It has a larger risk of kidney issues in the long term and a larger risk of bone density loss. And Whereas Discovery, if memory serves, has a larger risk of affecting cholesterol levels. Some people can tolerate one, but not the other. Anytime that you're on this medication, you're going to be having lab work every 3 months, both for STI testing and to make sure that your kidney and liver are working well. But the idea behind it is that it is a combination of two different antiretrovirals that help prevent contracting HIV.
And I had a friend, actually, my neighbor, went back home to Texas. We're here in San Francisco, where pretty much every gay man in San Francisco is on an antiretroviral, either for treatment of his HIV or in the form of PrEP to prevent it. And my neighbor went back to Texas and saw a doctor there for one thing or another, and the doctor had no idea what PrEP even was.
That is very common. I will say, just for knowledge sake, Descovy is only approved for people who were born male, not female, and Truvada can be used in people born female. And then they did just release and improve the injectable version. I believe it's called Apretude.
Yeah. I think it's every
3 months, I believe, kind of like
sounds right.
Kind of
every
like
2, I think is what I saw. Okay.
Yeah. And I have one resource. I want to say like I have somewhere a resource on it, but there's lots of usually there's a somewhere in your community that I found that will actually do all of this very, very well. Even in like North Carolina, there were places if people wanted, usually there was like one in Raleigh that are very, very good at this. And if not, I will find a website that I used when I prescribed it because it was hard for patients to get, like, if I could do it, then why not? In case you are a prescriber and you want more information about it, or if you're just a patient and you want more information about it, because most of the time people don't know about it or your provider doesn't. And this is a good thing you could bring with you. And it is by, I think it's from the CDC, and there's one from the, I think Reproductive Access has a really good worksheet on it too. And you can bring it. It has like QR codes. They can scan it and get information.
Sometimes the health department is the only place you can go, but they should be pretty trained. Even in the more rural areas I've been to in South Carolina, they were pretty trained because it's important for public health.
So I think what viewers should know is that, first of all, there's a pill to prevent you from getting AIDS, from getting HIV. It's not 100%, but it decreases the risk a lot. Also, somebody who has HIV, who is on medication and is keeping the amount of virus in his or her system down very low to its undetectable is what we call it. It's almost impossible for that person to give you HIV when their what's called a viral load is that low. So if you didn't know, if you're in some part of the country where you didn't know this existed, oh my God, I'm so scared of HIV. I met this guy who's positive, but I'm scared, whatever it is. If he's undetectable, it's almost impossible to give it to you. If you're still concerned, and whoever you're having sex with, there is something called PrEP. And if you and there's also Plan B for HIV. There's also post-exposure prophylaxis. So if you have unprotected sex and you think, oh, I was exposed to HIV, within the next couple of days, just like Plan B for pregnancy, you can get certain medications that will decrease the likelihood of you getting HIV. And if you're in a part of the country too where this isn't, you don't have a public, a gay men's health clinic on the corner, and your private doctor, you don't have access to healthcare. There are now, I've seen, I'm not going to say names, but there are some of these telehealth, the same ones you can call and get prescription from a doctor for Viagra over the phone. Some of these services will also do PrEP. And call that a prescription in for you to get at the local pharmacy. And the pharmacy, some places may have to order it if it's not something they normally dispense, but everyone should know that those resources are out there.
The two things I want to shout out. One is Ready Set Prep. If anyone isn't familiar with it, if memory serves, they work with the CDC and the government, where if you don't have insurance, you can get PrEP for free. All you'll have to get is your lab work and a doctor's order, which a lot of times you can do at the local health department. The next important thing is one of the things that I've seen across the country is CVS. If you have a local CVS, a lot of them carry PrEP, and you will be able to get, if you go through Ready Set Prep, you can a lot of times get your medications through them. And I hate advertising, and I'm not a fan of corporations at all. I think they're all evil. But when they're doing good things, I'm going to call them out on the good stuff they're doing.
Yeah, for
The other
sure.
option,
That's
especially
really helpful.
Yeah, for the post-exposure prophylactic, sometimes they don't carry those as readily as at pharmacies. But if your local hospital has an outpatient pharmacy, you might be able to get your prescription sent there, because they'll definitely have it, because they have it for patients who come in after sexual assaults.
That's really helpful.
Yes. And then the other thing, based on what Scott was saying, I think there's not a lot of education in the labor and delivery world about undetected viral load in patients.
Undetectable?
Yeah. Because I've had personal experiences with friends who had undetectable viral loads, and they pretty much weren't allowed to chest feed, vaginal delivery, things like that. Like, there's certain things where you have a detectable viral load, and with HIV are suggestions. But if you don't have, like you said, it's virtually impossible to spread HIV if you have that undetectable viral load, and much, much lower. And so we really should be encouraging our patients, if they have the desire to be chest feeding and to have the birth that is going to be best for them.
Yeah, now the research I know of says that it's almost impossible to pass HIV when you're undetectable through sex. Now, I don't know what the research says about passing parent to infant through vaginal delivery or breastfeeding.
It's the same.
Is it? Okay, good.
Yep.
You guys I'm so glad you're here. That's all I'm thinking.
You're going to have an educated viewership.
Helpful. Yeah.
I was like, how do we make this like an every other month sort of thing? We just get together.
I'm down. I'm down. That's my goal for Nurse Tube. I want to infiltrate the internet and just be like, topic, go.
This
is our second one this week.
As a healthcare worker, I also want to remind people, because there are a lot of things that one person knows about that other people don't. And, with having a lot of HIV patients, and again, I work in geriatrics where we use a lot of CNAs and whatnot. A lot of times I end up educating, look, just because these people have HIV does not mean that wiping their poop, you can get it. Right? If you expect bodily fluids to be sprayed on you into open wounds, orifices, whatnot, use appropriate standard precautions. And really and truly, whether it's through needle stick injuries, my first year in nursing, I gave somebody a shot of insulin, pulled back, went to engage with safety, my hand slipped, ended up stabbing myself in the finger. That was a whole workers' comp waste of time. But it was one of those things where I was like, look, one, the patient that I have is really low risk for HIV, Hep B, whatever else. I've been vaccinated against these things. And, even in the case where there is an open wound, specifically needle stick injuries, that is super low case of any sort of transmission. So just remember that just because you may be dealing with parts that aren't as fun to deal with, shall we say, or matters that aren't as fun to deal with, use standard precautions, be wise, but you don't have to treat these people, whether they're undetectable or not, any different.
Well, don't wear more protection. That was one of my biggest pet peeves that I often had to have conversations with about fellow nursing assistants. If someone had Hep C or if someone had HIV, they'd be gowned up, face mask, whole thing going in just to change their brief. And I was like,
do their vitals.
That's discrimination. That doesn't make them feel good. You're treating them poorly.
Even with patients who do need that, you kind of want to try to get some humanity through that protective equipment and go, hey, I'm sorry I look like a Martian right now. I'm not, it's not that I'm afraid to touch you, but I got to protect myself. You have a virus. And so, try to get some humanity to go through instead of just walking in like an astronaut.
one, making sure
Mhm.
we do take the right protections, right? Like, so often
Yeah.
I know I've been in situations, I've seen people in situations where you're rushed, maybe there's a specific medication you give and you're supposed to be gowned up, you're supposed to have the red cardboard disposal box, you're supposed to have everything, and people just don't do those things because they're seeing it as a waste of time. But like,
Yep.
those are important things, and like, for nurses out there, like, don't ever let anyone guilt you out of doing what you're supposed to be doing for the safety of you and your patients.
Mhm.
And make the doctors throw away their own sharps. I call them back in the room. I'm like, no, come here. You're not done yet. No.
Yeah.
Are these your sharps?
Here you go.
Get them.
I'm not your maid.
Mm-hmm. And Mama Nurse
Yes,
said I did a
doctor,
class
whatever
on
you
that.
say, doctor.
No, not here. No, friend. I did a class on that recently. It was a 0.7% chance of getting HIV from a needle stick for healthcare workers, which I think even just knowing that, like, they make you so scared. At least when I was in nursing school, they made it sound like if you were getting stabbed with a needle, like, I mean,
That happened
straight
to me.
to
My
AIDS.
first
Just
nursing
skip
job, I was in
HIV.
the
Just like
ICU.
done. Yeah.
Had an AIDS patient. I was doing an ABG on the butterfly, and that little butterfly flipped around and got me in the finger.
Yep.
And it was a big deal. I had to go to the ER and
Mhm.
go. At that time, it was only AZT, which was made me so sick. And the risk was low, especially with the small volume. I guess that's an average that Mama Nurse brings up, because I imagine if
Mhm.
the more fluid that enters your body from your patient, the higher the risk.
Mhm. The
But
type of unit,
that's low.
yeah, and what
It's
your
not,
patient
it's not
population
like you're
is.
gonna
Yeah.
breathe.
Mhm.
It's not airborne.
Yeah. No. Yeah. That was a huge learning curve for me. Not with we had some patients that had HIV, but I worked on a GI liver floor, and easily half our floor had Hep C. And I was terrified when I first got there, because like school had taught you, like, this is basically in the air you breathe, and that's just not. It's like, oh.
Right. They teach
And
you
now,
to be so scared of a needle stick and everything. And like, right, we
Yep.
should be very cautious.
Mhm.
But at the same time, then they also don't teach you about post-exposure prophylactic, or the fact that we do have good treatments for HIV now, and you can get to an undetectable viral load. Like, if you're not teaching those other things, of course everyone's going to be so freaked out. And it's to the point where, I had fellow nursing students who were scared to practice IV starts on patients, because they were like, oh my God, I'm going to stick myself, and I'm going to, like, it wasn't even about like being afraid of hurting the patient at that point. It was like purely self-preservation. And I was like, people do this all day, every day. Like,
yeah.
Okay. Just take
It's
a deep
gonna be
breath.
okay. We can do it.
And even Hep C is treatable now in many cases.
Yes. It is so much more treatable. And then
And A and B you can get vaccinated against. So
And also
Heps.
Right. And just
No, go
because
for it.
we can, just because, we know that the chance of getting it is so low, doesn't mean you shouldn't go through with your testing and stuff with workers'
For
comp,
sure.
right?
Yeah.
Is like,
This
it's hard
wasn't to negate that. Yeah.
We're
not saying just go wild.
Because I mean, I know nurses too who have been like, I don't want to write up the incident report. Like, it's no big deal, whatever. And it's like,
no,
like, you should still do it. And like, if it is a big process to do it, your hospital should be taking that in, because that's a safety issue. Like, if your hospital is making it a hard process, then they need to be fixing that.
Yeah, for sure. I did want to hop back really quick. Angelica, thank you for the super chat. That is super duper sweet. She said, I really appreciate these conversations. I'm starting nursing school soon, and I'm happy to bring this knowledge with me. Thanks, everyone. And that is literally the goal of why I wanted to do this. And I think why everyone is donating their time to come here today is because they just want you to know. They want to talk about it more, because this isn't something that we regularly talk about within healthcare. This isn't something that nursing school or NP school really harped on. I think they were like, some people like might be gay. Moving on. And you're like, that was the whole section. And then you were like, okay, that's great. Like, that was horrible. And that's why we want to have the conversations. Exactly. Like,
Angelica, you're going to do great. It's going to be awesome. And you're going to be able to take this information and this link and share it with other nursing students. If you're not getting that information, be able to find good education to spread around too.
Surround yourself with good people, supportive people, and don't pay attention to the naysayers if this is something you really want to do. I hate those videos. I quit nursing. I quit being a doctor. And You know, if that's the right decision for you, that's great, but don't scare people off.
I'm going to take the opposite view of this. You're going to struggle in nursing school. You're going to have a really hard time. It's going to be really rough. It's going to be hell. But just trust me, struggling is normal. There are going to be classes that you are going to be eating dirt on the whole class through. There are going to be classes that you get and just fly right through. That's okay. It does not matter if you get an A. It does not matter if you get any other letter. All that matters is that you end up passing. That's what matters. Keep your eye on the goal, which is passing.
And if you change your mind, it's okay.
Your school just has to give permission for you to take NCLEX.
Mm-hmm.
And if you
Yep.
pass NCLEX, which I found was a lot easier than my nursing exams.
Oh, yes.
Oh, yeah.
Yes.
You're
Yep.
good.
Yep. So you have all the different opinions. We have Optimist Scott. And then we have, on this side, we have a little bit more doom and gloomy. We're like, it's going to suck. It will
The real world
hopefully
is
one day
hard.
end. And if you hate it, you can change your mind.
Also, nursing
Yeah.
tends to feel like you're
Yeah.
in high school again. Like it tends to get very cliquey and things like that in my experience. And don't
Mhm.
fall into the drama because you don't need more on top of the hard work that you're already trying to do.
Mm-hmm. Yeah.
Stay out of it.
Drama.
Amen. Absolutely.
Somebody made a comment that refers back to something I was talking about like being honest with your doctor, even though it's embarrassing. He was saying he has a problem with hemorrhoids, and hemorrhoids are a problem when you have sex in certain ways.
Mhm.
And he's embarrassed to see his doctor about it, and that's a shame, because you should be able to talk to your doctor and say, hey, look, this is not just hemorrhoids like for everybody else. For me, it's actually, this may be giving too much away, but when I had braces, there was some kind of a metal square, something bracket on the inside of it, and you could hurt somebody that way. In certain situations. I was young and I didn't. Am I being tactful enough?
You are.
So I had to tell the dentist that it really hurt my tongue. Because I was 19, I couldn't really talk to the orthodontist who's used to treating teenagers, But same with these hemorrhoids, hopefully you have a doctor that when you explain it, that say, yeah, it is a little bit different for you. It's a little higher stakes.
And say that,
and not
because
only like for your physical health, but like sexual health is also your mental health, and you deserve to have good sex. And if it's keeping you sex, and that's part of what makes you happy, makes you feel good about yourself, then your doctor should also care about that.
And if
they don't, then I hope you can find a one that does.
And just a note to any providers watching that, different things mean different things are more important to some people than others. So for, Joe, Jane, next door, heterosexual, having hemorrhoids is an inconvenience. This is impeding on someone's sex life in this case, and needs to be treated with that same amount of concern, with the appropriate amount of concern for that.
Is a good time, if you are a provider, to always ask, how is this affecting your life? Like, because the symptom is going to be like, so what is this actually doing? And if they're not asking them, then maybe offer that information, because it's going to be much different if someone's saying like, hey, I have this, it's uncomfortable if I sit like a certain way for a long time. We might take a very much more less hardcore approach, because there is treatment for that. It's just a little bit more hardcore if we really want to get rid of them, which you probably would want to do in this situation. And so if you are uncomfortable saying that, you could always write a message. I had a lot of patients that would write me messages through our portal about things that they didn't outright feel overly comfortable just coming out and saying. And then we were able to talk, like, I'd be like, okay, like, that's fine. Let's come in for an appointment. I could bring it up. And then just not having to verbally say it initially was usually a huge, once people got over that, then we could have a whole conversation and it was fine. But that is something that you can do, is usually message them.
Right. Or if they don't have a
or write it down.
Or email, you can write a little letter, even like write a little note. You don't even have to give to them in person. You, when they put you back in the room, you can ask the nurse, like, hey, can you give this to the doctor before they come in for my appointment, and have them read it. So that way they're not sitting, you don't have to be like, here's this thing I wrote you. And they're like reading it in front of you. Like that can be awkward too. And so like there's ways around it. You just got to be a little creative sometimes.
I had a lot of older patients who had concerns, especially when they were surrounding like any kind of sexual intimacy, that would write me letters, like notes, and then they would hand it to me, which I saw someone earlier talking about, like they're older and they feel uncomfortable talking about it. Any way you feel comfortable talking about it, and you should never disclose things that make you feel uncomfortable. You know what I mean? So if you're ever in that situation, you can just say, I don't feel comfortable talking about that. They should respond and say, this is why I kind of wanted to know. And so if we don't dive into that, this is like, we might miss a few things here, but you should never be having to have conversations where you're feeling like you're being interrogated or it's uncomfortable or anything like that.
You
at
can
all.
even ask, is there a particular
Mhm.
reason that you want to know that
Mhm.
information?
Yep.
So that way you're not
Yep.
just like saying no up front, but it gives you more information, that informed consent model, right? Like, I want to know why you need to know this information. It's personal. If it's a good
Mhm.
reason, then I'll make the decision for myself to give you that information. Like,
Mhm.
I think
Mhm.
it's incumbent upon us as the healthcare providers to teach patients how to interact with us, give them to normalize things, to give them the language that they need. So in that spirit, instead of hoping patients know, that they can write notes and emails, that we can just say, hey, look, I'm going to ask these questions and you give me your honest answer, or say, can we come back to that? Or
Mhm.
say,
I like that.
I'd rather
Mhm.
not say right now. Give them the language
Mhm.
that they need to be able
Mhm.
to turn you down, hoping that they won't use it. But
Mhm.
sometimes people don't even know the words. It's like and if you don't know the proper terms for something, use the vulgar language. I've heard words. I'm a
Yeah.
nurse. Just
Oh,
bring it up and
I was
say,
gonna say, there is nothing that, yeah, you can tell me that
you
I
can't
I
make us
got a
have
big
blush.
not
red thing
heard.
on my nah. So
We
we need
want
to
to know. We want to
give
help.
them that
Yeah.
language.
Hmm. For sure. And Megan too, I see personal issues. So you don't have to disclose it to the front desk either all the time. Pretty much they're just personal issue.
Follow up.
Exactly. A
Well, they're
follow-up or
usually
a
just trying
person.
to figure out how long to schedule the appointment for, right? Like,
Exactly.
if
Yep.
it's a major
Yep.
issue, then maybe it's going to be a 45-minute appointment instead of a 20-minute appointment. So
Well, maybe
Oh,
we
I
should educate
wish.
the office staff too, to say when someone comes and
Mhm.
says, I need an appointment for a personal issue, ask them, is it a 15-minute personal issue or a 45-minute personal
Mhm.
issue? Maybe
Yeah.
we need to educate the office staff too.
Yeah,
oh my goodness.
that's a really good point.
My God, I'm starting to think like
Steve,
a
thank
5-year-old.
you. I know you're doing a great job. Steve Deacon, thank you so much for the super chat. Thanks, guys, for your help and advice. I think I'll take your advice and use the chat portal with my doctor because I would struggle to bring it up in person. Absolutely. And I hope you feel better. Those are miserable. Those are just
Oh yeah.
not fun.
I suggest
Even a
a
little bit.
bidet. You can get those bidets that you can like put on the toilet. That's what
Yes.
my OB-GYN
And
told me, and I'm not embarrassed to say it.
as a just a PSA, these are so common, and this is like the number one thing that I feel like people struggle with. There are solutions, my friends. Without even like, there are conservative solutions. Maybe we'll have a whole talk on them one day, but that's like the number one thing that
Hemorrhoid
people,
show.
Yeah, the
yeah,
hemorrhoid
you'll just
panel.
discover them. And I'm like, oh, like, has this been happening a long time? They're like, oh my gosh.
It's been
Yes.
35 years. And you're like,
Yeah.
my friend, you didn't have to struggle this long.
Or yeah, oh yes, they're not fun. Or I have patients that come in and they're horrified. They're like, there's a flower in my butt. I'm like, no.
I had a patient tell me there was a chicken nugget in their butt one time, and I was like an
Yeah.
actual chicken nugget? Like, you did
Uh-huh.
how did it get there?
Yep. I had someone, they were like, it's sprouted. I was like, come again?
I do have an old ER story about that, but I'll spare you.
All right. Anything that you guys want to talk about that we didn't get to, and then we're going to wrap up with Michael Garza. It asked a very nice question just about queer joy. And so we're going to end with that as just a way to wrap things up on a positive note. Or allyship, the open doors, fostered connections, or positivity in your practice, which I think is a beautiful way to kind of wrap up this discussion. But is there anything you guys specifically wanted to talk about before we wrapped things up, of like what you wish people knew, either like to a provider, to anyone in the healthcare community, or anything like that?
Pronouns. How to ask about pronouns. People get so
Yes.
scared to approach the subject, and then it doesn't get brought up often.
Mhm.
One, the best way to be great about pronouns is to tell your pronouns, even if they're perhaps the ones that would be assumed for you.
Mhm.
So that's introducing yourself. Like, I'm Zan. or I'm Liz, I use she, her pronouns.
Mhm.
What, you
Mhm.
know, what's your name? I don't usually ask my patients their pronouns specifically. I'll just
Mhm.
say, you know, I'm Zan, I use they, them pronouns. How would you like me to address you? And that kind of opens
Mhm.
the door for them to tell me about
Yep.
pronouns if they want to.
Mhm.
But also, like, sometimes you have older patients who, like, if you ask for pronouns, they'd be like, what is that? Why are you asking me that? And
Uh-huh.
they sometimes they want you to call they want you to call them Mima, you know? So it's just like a good
Mhm.
broad way to respect your patients, but also open that door for the people who need it. And then if
Mhm.
you do need to know that for some reason, just straight up ask. Just say, what pronouns do you use?
Mhm. Yeah.
It's very direct. And like, I don't know any trans person who would be like, I can't believe they just asked me that. Like,
Mhm.
please just ask my pronouns instead of like accidentally or like purposefully calling me ma'am or sir or like skirting around the issue. Like, I have the information. I just don't always present it because I don't know how much you want it.
Yeah.
And there's a
Mhm.
really good link that I can send you, Liz, to put in the chat that
Perfect.
online, and it's how to practice pronouns.
Oh,
So you
cool.
can like pick a pronoun you want to work with, and it'll help you
Mhm.
like conjugate it depending on different things, and you get it's like multiple choice fun game thing.
Oh, that's cool.
Yeah, so that's always a really helpful link I give to everyone.
Thank you. I love links. My patients were so sick of my worksheets by the time I was done. I was like, I have a worksheet for that. I have a worksheet for that. I have a worksheet for that too. They're like, oh my gosh, Liz.
Here's your binder.
Exactly.
Here's your homework. Do this before you see me next time.
Yeah. I was like, I printed this out. I printed this out. I saw this recipe that I thought you might like. So I put that in there too. And they were like, okay.
Yes, please.
Yeah.
Pronouns are confusing, and
Yeah.
I was thinking about it, and I need to think more about it. This is something I need to educate myself more on. The pronouns, he, him, they, them, she, he, are in the third person. So you'd really only worry about that when I'm talking about you to someone else. But when I'm talking to you, I'm using you. So that's not gendered. But what is gendered is sister, brother, mother, father, parent. I met a non-binary person at the dog park, and they had little Fido, and I said, just so you know, we don't really worry about people names. We just refer to you as like, I'm Dottie and Zach's daddy, and that's Chester's mommy, and I guess you're going to be Fido's mommy, daddy. But oh my God, I'm stuck. And it's like, oh, parent,
Yeah.
parent. So sometimes it's not the pronouns, it's the nouns that give us the trouble.
Right.
And
But again, just
hopefully if I
ask
did
them,
that
how
with
would
a
you want to be
patient,
referred to?
hopefully if I made that mistake, you know, and I said, oh, so you're Fido's mommy, and they would say, really, I prefer Fido's parent. I'd be like, oh, yeah, of course, thanks. You know.
Right. Okay, so that leads me to
Good
my
stuff.
second
We gotta
point,
work
actually,
together.
now that you remind me. So that's the thing is, like, if you do slip up, just be like, oh, sorry, correct yourself and move on. Don't make this whole scene about apologizing, because then I have to be like, no, it's okay. And like, really, like, it's not always okay, and it's not about you. Like, just like, oops, sorry, slipped up, just like you would if you were like, oh, your daughter is so cute. Well, actually, it's a boy. Your son is so cute. And then you just move on. And like, also, we can tell if you're doing it on purpose or like if you slip up. And like, I always say, like, I don't get upset when you misgender me as long as you don't get upset when I remind you. Right? Like, I've misgendered myself. Like, how am I supposed to expect everyone else to get my pronouns perfectly? Like, I don't, but I'm just like, if you slip up, I'm just going to be like, oh, they. And then you just say, oh, yeah, they. And then you just keep going on with the conversation. And it's not a big deal. Like,
and I think a lot of people are so nervous to say anything. Like, I put my foot in my mouth constantly, and that was going to be my one thing of just like, do it and then just apologize, mean it, take it, see, like, make it more of a learning experience and move on. Cause I've seen so many people that are like afraid to, they don't even want to get into the conversation because they're going to say something. I'm like, just say it and like genuinely like try. And then like, if you mess up, just apologize and move on. Like it's going to take like, I mean, I've put my foot in my mouth a million times. I see someone with a wedding ring. I'm like, oh, your wife. And they're like, actually my husband. I'm like, oh, sweet. What's his name? Like, and then I feel like I'm crumbling and dying on the inside. But like you said, that's my problem because I assumed something with my bias that I walked into it with, and I've never done that again. Like going forward.
And we're not sitting there trying to like make you feel bad about the fact that you slipped up and misgendered us. But like at the same time, I don't need to feel bad that you misgendered me either. So it's just like it's not this big thing really all the time, and it keeps people from talking to me. It keeps people from like communicating about me. Like you said, like it's only a big deal when you're not talking directly to a person, but the amount of times I've had people like medical professionals misgender me within earshot, or even say really negative things within earshot, that's not adequate care either. And so like if I'm doing report, we usually do like our big report out of the room, and then you step in and you kind of give the brief overview and you write your name on the board or whatever. But like if someone misgenders a patient, I just say, oh, actually they use they pronouns. And I know that the times that someone has said that for me when I've been in the hospital has made such a big difference, right? Like really feel like you're cared about, that people are paying attention to your needs and things like that. And it's huge.
Yeah. You're like, oh, you're paying attention. That's a delight.
I would say to providers that are watching, nurses, future nurses, any kind of provider, consider that there are people who are not heterosexual, who are not traditional gender people in the world. And you don't have to be an expert on them, but just recognize that that's the case. If you make mistakes, that's fine. Try not to make them again. Try to learn a little bit about them. Treat everybody with respect, whether you think it's some kind of moral failing or not. It's not a choice. It's not a moral failing. It's just a way of existing in the world. But keep it to your damn self and treat everybody with respect, because that's what healthcare is about. That's what's best for the patient, which is why we're here. For patients, I would say find and keep good providers. You don't have to disclose what you don't want to disclose. If you feel like you can disclose more, great, for your own well-being, for your own benefit. If you feel like you can educate your providers and the people you come in, and this goes beyond healthcare too. I was
going to say that goes for work. I feel like too, like your work setting.
If you feel like you're in a position to do that, then you're going to make things better for all of us. It's always your choice what to reveal and what not to reveal. And for everybody, ask questions. I mean, I've been in this whole gay game for a long time, guys, and I'm still like, what pronouns do I use? What nouns do I use? We're all still learning and we're all still improving. But the core of it is don't assume. Recognize that not everyone's like you. That's a big problem, but I don't want to get on some box about that. So find good care, be a good caregiver. Good luck to all you future nurses.
Yeah,
that was perfect.
Like you don't have
I feel like that could be, that could be a whole video. Yeah. Not everyone is like you, Karen. Therapy with nurse.
The nation needs therapy.
In healthcare, like I'm here for your medical opinion, and that's it. That's the only opinion I want.
And like Erin said that they have a they them child and a they she, and they're just millennial youth are going to move the needle forward, and I'm so proud. I think that's true. Like I think it's so much less of an issue with people who are younger, that it's just something they're growing up with as being normal, and so they're like, okay, like cool, whatever, it's fine.
I love hanging out with teenagers because they're like, and what are your pronouns? And I'm like, oh, thank you.
They have a whole different way of thinking about sexuality and gender. That there are. What am I trying to say? There are surveys that show that like the kids in that teenage range, there's like 20% of them don't identify as male or female, but some shade of gray. At least for now, it may just be a phase, and they may say, I just wanted to kind of get a feeling of where I am, and yep, I'm where I started. But and I think similar numbers for heterosexual, homosexual orientations. Kids are just much more fluid with this and willing to explore, and maybe they'll all come down where they started at the end. But it's a different different mindset about this whole thing, for the better.
Yeah, for sure. So we can get away from this. Family says she hearing it's upsetting to my kids. Absolutely, that would be upsetting. When you're telling someone who you are and they're like, no,
you're not.
As someone who's been in that situation where even my own parents misgendered me, like, stand up for your kids. They're kids, or maybe they're adults even, but like it means so much to have someone else have to someone else put in the work and be like, actually, no, because it's exhausting. Every conversation, everybody I meet, having to out myself just to be respected, having to explain it. And like within your own family, you should feel safe. And like, just like if they were doing something else to harm your kid, you would stand up for them. My suggestion, and it is always stand up for your kids in this situation too.
It's hard.
Cal, do you have any imparting words of wisdom? You did have your excellent topics before, which I was very glad.
I think if there's one thing that I can say more than anything else is that things are slowly getting better. It is taking time. You know, having, you know, there's still a lot of work to go, the same way that there is with racism, the same way that there is with recognizing that, you know, and actively trying to include everybody. And the challenge that I would give people is that, you know, as a white guy who can pass as straight if he wants to, use whatever platform you have to help bring people up. Because what really matters is the people who you bring with you, not, you know, where you end up.
I love that. Thanks. Well, thank you everyone for being here. Would we like to end with our, what did we call it? Queer joy moment?
Your affirmation. I live to hear your affirmation.
We will definitely end with that. Michael Garza, he wanted to know about your queer joy moment for a second. What are some ways that being LGBTQIA plus or an ally has opened doors, fostered connections and positivity in your practice? I guess I'll go first, and then we'll just go around, and then we'll end with my little mantra thing. And before we do that, I just want to say thank you so much to all of you guys for being here. It has been, I could not have done this conversation without you, and it's been so, so helpful. And I think people have really enjoyed it. And I hope we're going to change the world just by talking about these things and making people more aware of them.
It's a start.
Definitely go check out Nurse Scott's video on this particular topic and his channel in general. And we will just continue to bother the other two until they make their own social media. So one day we'll get there, friends.
I might put my LinkedIn in the description in case anyone needs someone to help with inclusion in their practice.
Are we advertising what we need on here? I'm single, so there's that.
This is turning into a video stream. Okay. Super chats for Nurse Scott's phone number.
Yeah.
How high would you like me to go?
And here I thought it was just one civil.
Yeah. How much do you think Nurse Scott is his number is worth to you?
Exactly.
Auction
so bidding at $10. No.
Now, at my age, I'm giving it out for free.
Oh, don't say that on here. They're going to give me money. Okay.
Don't sell yourself short. Don't do that.
Okay.
Be quiet.
I don't, to answer the question, I don't think I've had a queer joy moment I don't think it's opened doors, but I know in general, being in the queer community, I've met people I would never have met if I were just stayed in straight circles. I just feel like I've met drag queens, and I've met leathermen, and I've met dykes, and I've met lesbian activists, and I've just so many different people, so many experiences. It's just such a rich life, don't you think? I can't imagine just living and maybe not many people do live the little stereotypical heterosexual 2.3 kids in a house and pick a white fence. But if I'd done that, God, what boring life that would be. I'm so glad that I've gotten to push my own boundaries and of assumptions that I've made and everything. So that's queer joy is realizing how, and then that bleeds over into, hey, there are also racial differences and religious differences and all that. And it has enriched my life being exposed to all of that.
As a person in a heterosexual relationship with a dream of a picket fence and 2 children, I take very deep offense to that statement.
But you don't live. Your circles are much wider than that.
I was just teasing you. Yeah.
I know. Well, good point. Even if you are, you can have a wide range.
Absolutely.
Range of influence.
We're a great gateway to the rest of the world.
We're the
Seriously,
gateway
the
minority.
nicest, nicest people, like, just, yes, sweet humans.
I think
Do you
that's
have a moment of,
sorry.
I will tell a story about this. I worked at a private Christian facility, skilled nursing facility. And I don't know if you can tell, but like I dye my beard on a regular basis. Well, my barber does.
Looks
And
great.
I do it for religious reasons, kind of unrelated to this. But one of the reasons why I do it is that, I'm very comfortable in who I am, and being in the South, that's not something that's terribly associated with straight people.
Mhm.
And I had this patient who asked me, like, hey, I noticed your beard is like fire engine red. Like, what's, is there a reason for that? And I said, hey, look, I do this, primarily because it's a way to, in a non-confrontational way, say, hey, look, I'm not straight, and I want to make room for, the area that I'm in is not necessarily, it tends to be relatively conservative Christian, where it's not LGBTQ friendly, where I want people to know that, hey, look, the best nurse that they've had, the one that's been straight up with them and forward with them, and takes care of mama, grandma, mima, grandpa, whatever term they use, and the one that they care about isn't straight, and that's okay, and maybe we can rethink this. And she understood that. She had this huge grin on her face, and she's just like, thank you. I appreciate that, because she had family members who were actively being shunned for being not straight.
That's excellent.
And you have to kind of be that person to show up and be like, yep, it's fine. Till enough people are like, oh, it's fine. And we can kind of push out the people that are.
Yeah. Well, yeah, and you said you worked with like the aging population. Like, we do have an aging queer and trans population, right? There are going to be more and more of us, thank goodness, that are living until seniority. And like, we need people who are prepared to take those cultural considerations into account. So,
well, that's one of the important things we do when we come out, is we say, look, we challenge people's stereotypes, and we challenge their assumptions. So you having a red beard, me wearing a pride flag at work, or something just says, hey, you think you know what gay people are, but now you can, we challenge that. Or you assumed we were all gay. Guess what? We're not.
Yeah, for sure.
Or we're all straight. Okay, did I say that backwards?
Yeah. Anyway.
I get confused. Gay, straight.
Whatever. But I think as far as like making connections, right? Like, none of us would have been here today if we didn't identify this way. We wouldn't be making these connections. The work I do to help people, like offices and departments, become more inclusive, I wouldn't have that knowledge if I wasn't experiencing it myself. I have that firsthand experience of things I wish were different in offices or departments. And now I can take that and help other people. I got my job. I mean, I don't think I got my job on the unit where the bottom surgeries happened because I was trans, but it definitely was like a selling point, if you will. Like, your patients will have someone who identifies similarly to help care for them. And, I let them know up front, like, I'll be more than happy to provide in-services for training, whatever. And so, like, those sorts of things, like the right people want this sort of information. The right people want to get to know us and want to make sure that people like us are comfortable and are being able to get care. And I think that's great. And just kind of like on a personal note, my queer joy right now is, like, as someone who has lost family and has been homeless, I am happily engaged in closing on my house tomorrow. And like, I wouldn't be able to do that if it wasn't for being able to make these connections, being able to use my identities and these sad things I've gone through to make an income and make a brighter future for myself and my family. And like, that's also queer choice. Like, it doesn't have to be the negative, but it sometimes can be related to the negative, and it can be like a metamorphosis moment.
And queer joy is available to everybody, even our straight allies like Liz, who brought us all together today.
I need to make that a sticker.
Being involved in queer culture, and you have that available to you, and we really could use all the allies that we can get. They're very, very precious to us because it's not their fight.
Yeah.
So it's very touching for anyone who it's not their fight to take that on. It just means the world to me, and I'm sure to a lot of other people too.
Right. And
that's hopefully how we're going to change stuff.
And you're
by realizing that, maybe we can help with other people's fights.
Yeah. You're never too small to be like, if you're sitting here thinking, well, like, I can't put a whole panel together, I can't do that. No, maybe not. Maybe you can, but maybe you can. Yeah, maybe you can. Bring some education to your unit. Maybe you it's something that are just like little small things. Maybe it's your day-to-day life. You just you make sure that you stop assuming, like Scott said. And so when you do meet someone, you say, oh, like, I see your wedding ring. Are you married? Do you have a partner? And just little things. And that's huge.
Start with the smallest little thing. The next time somebody makes a gay joke or slur, right, just give them the stink eye. That's the very least you can do.
My favorite is to ask, oh, why is that funny? Like,
why is that funny?
Dumb. Just be like, can you explain it to me? I don't get it.
Yeah. Is that a joke? It's not funny.
If you don't want to speak up, you can still give them the stink eye. It's all I'm saying.
Yep. I feel like you're more diplomatic than us, Scott. I feel like we're drawing a line in the sand, and you're like very eloquent. And Stan and I are like, what's your problem?
Not everybody's ready to do that, right? So let's give them the.
No, that's why I'm very glad. Yes, that's another beautiful thing of these panel discussions. Yeah, is once again Scott's bringing us back down. He's like, whoa.
I get really radical really quick.
I do.
I'm all for that. I'm all for that, but not everybody's ready to do that, is all I'm saying. Yeah, I'm all for that.
And that's why we very much appreciate you. Yes, Chelsea's right. Scott is our level-headed counterpart, and we need you. The world.
Love you.
Yeah.
We need
some. When I rule the world, you will absolutely be in my cabinet being like, Liz.
Oh, good.
Liz. Remember what we talked about, Liz. Stop.
I would like to request to be the devil on your shoulder.
That sounds
to be
perfect.
the angel.
I'm good at devil's advocate. I'm good at that.
Yes. Perfect. You can be our philosopher, Cal. I feel like you could fit that role. You could just be like every now and then just dropping bombs of like super sage wisdom, be like boom, and we're all like, oh yeah. Okay, yeah. Perfect. Well, thank you so much, everybody. This has been like so cool to see this be able to happen. And I'm super duper appreciative for all of your time. And just all of the incredible knowledge and like willingness to share about your own lives and everything like that. I think this is going to be super helpful. More than happy to do it whenever. Let us know in the comments if you guys out there like this type of format. I think it's really fun. And hopefully you like it because I'm just going to keep happen. Okay. Single-handedly. It's going to be fine. I very much appreciate all of you for spending your time here today. Make sure to check out these people who are willing to, and we're going to bug them. We're going to bug the other two, where they are on social media and the links that we have down below. And do always remember that you are more than enough. You, my friend, are not alone, and you can do hard things. And we'll see you next time. Bye, friends.